Artificial Intelligence Dr. www.abcpharma.net/English. User question: how to diagnose pacemaker syndrome in a patient implanted with an Aveir VR leadless pacemaker using an electrocardiogram, ECG. ClaudeAI answer: diagnosing pacemaker syndrome in a patient with an Aveir VR leadless pacemaker using an electrocardiogram, ECG, can be challenging, as the ECG findings may not always be conclusive. However, there are certain ECG features that, when combined with clinical symptoms, can suggest the presence of pacemaker syndrome. Here's how to approach the diagnosis. Assess for pacemaker activity. Look for the presence of pacemaker spikes before each QRS complex, indicating that the pacemaker is actively pacing the ventricles. In an Aveir VR leadless pacemaker, the pacing spikes may be most visible in the inferior leads, 2, 3, AVF, due to the typical placement of the device in the right ventricle. Evaluate AV synchrony. Check for the presence or absence of P waves before each paced QRS complex. In pacemaker syndrome, there may be a lack of AV synchrony, with pacemaker spikes occurring without corresponding P waves or with P waves that are not consistently conducted to the ventricles. The absence of AV synchrony can lead to the cannoner waves phenomenon, where the atria contract against a closed tricuspid valve, leading to jugular venous distension and discomfort. Assess QRS morphology. Evaluate the morphology of the paced QRS complexes, looking for any abnormalities or inconsistencies. In some cases of pacemaker syndrome, the paced QRS complexes may have a different morphology compared to the patient's intrinsic QRS complexes, suggesting suboptimal ventricular activation or pacing from an undesired location. Monitor for fusion and pseudofusion beats. Look for the presence of fusion beats, which occur when a paced ventricular beat coincides with an intrinsic ventricular depolarization, resulting in a hybrid QRS complex. Pseudofusion beats may also be observed, where an intrinsic QRS complex occurs simultaneously with a pacemaker spike but is not directly caused by the pacemaker. The presence of frequent fusion or pseudofusion beats can indicate a mismatch between the pacing rate and the patient's intrinsic rhythm, potentially contributing to pacemaker syndrome symptoms. Correlate with clinical symptoms. It is crucial to correlate the ECG findings with the patient's clinical symptoms, as pacemaker syndrome is primarily a clinical diagnosis. Symptoms of pacemaker syndrome may include fatigue, dyspnea, chest discomfort, palpitations, or a feeling of pulsations in the neck, due to cannoner waves. The temporal relationship between the onset of symptoms and the initiation of ventricular pacing should be considered, as pacemaker syndrome typically develops after the implantation of the pacemaker. 6. Consider additional diagnostic tests. In some cases, additional diagnostic tests may be necessary to confirm the diagnosis of pacemaker syndrome or rule out other potential causes of symptoms. These tests may include echocardiography to assess cardiac function and AV synchrony, cardiac Holter monitoring to evaluate pacing behavior over an extended period, or exercise stress testing to assess the patient's symptoms and pacemaker response during physical activity. It is important to note that the diagnosis of pacemaker syndrome in patients with an Aveir VR leadless pacemaker should be made in collaboration with a cardiologist or electrophysiologist experienced in pacemaker management. The ECG findings should be interpreted in the context of the patient's clinical presentation, and a comprehensive evaluation may be necessary to guide appropriate treatment decisions, such as pacemaker reprogramming or consideration of alternative pacing modes or devices. ClaudeAI answer: diagnosing pacemaker syndrome in a patient implanted with an Aveir VR leadless pacemaker using an electrocardiogram, ECG, involves several specific considerations. Pacing spike artifacts. In the ECG of a patient with an Aveir VR leadless pacemaker, you will typically observe pacing spike artifacts representing the electrical impulses generated by the device. These spikes appear as sharp, narrow, tall deflections that coincide with the paced cardiac contractions. The presence and morphology of these spikes provide important information. Pacing site confirmation. The Aveir VR leadless pacemaker is designed for ventricular pacing. Confirm that the pacing spikes are appearing in the expected lead configuration for ventricular pacing. This verification ensures that the device is functioning as intended and that the pacing site is appropriate. Pacing rate and rhythm. Assess the pacing rate to ensure it is appropriate for the patient's needs and underlying heart rhythm status. Evaluate the regularity of the paced rhythm by examining the intervals between pacing spikes. Look for any signs of underlying arrhythmias, such as ventricular tachycardia or fibrillation, which could contribute to pacemaker syndrome. Capture and sensing. Examine the relationship between the pacing spikes and the QRS complexes on the ECG. Confirm that the pacing spikes are effectively capturing the myocardium and causing ventricular depolarizations, resulting in ventricular contractions. Also, assess the device's ability to sense the intrinsic electrical activity of the heart. Device malfunction. Keep an eye out for any signs of device malfunction, such as pacing spikes without corresponding QRS complexes, loss of capture, or missing spikes, failure to pace. These abnormalities could indicate lead dislodgement, battery depletion, or device malfunction, all of which can contribute to pacemaker syndrome. Comparison with prior tracings. If available, compare the current ECG with prior tracings to look for changes in pacing parameters, underlying rhythm, or the development of arrhythmias over time. This longitudinal analysis can provide valuable insights into the progression of the patient's condition and the effectiveness of pacing therapy. Temporarily adjust pacing settings. As a diagnostic test, you can temporarily adjust the pacing settings to an asynchronous mode, VVI or VU, to assess the patient's response. If the patient's symptoms improve or change significantly, it provides support for the diagnosis of pacemaker syndrome. Consider device repositioning or upgrade. If the diagnosis of pacemaker syndrome is confirmed, consider the possibility of repositioning the device or upgrading to a dual-chamber pacing system to improve cardiac synchrony and alleviate symptoms, especially if the patient has underlying cardiac dysfunction or persistent symptoms. In summary, diagnosing pacemaker syndrome in a patient with an Aveir VR leadless pacemaker using an ECG involves interpreting pacing spike artifacts, assessing pacing rate and rhythm, evaluating capture and sensing, ruling out device malfunction, and considering the patient's symptoms and response to temporary pacing adjustments.